It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that help change people's life. And speaking of the best, we'll start with one of the very best in the world.
He certainly is. He's a renowned dermatopathologist. It's Dr. Clay Cockrell.
Well, psoriasis is a fairly common disease. We see a lot of that in our practices, and probably a good way to think of it is normally it takes your skin about 6 weeks to grow from the very bottom layer all the way to the top layer. In psoriasis, that's accelerated up to about 2 days. So your skin is just growing much more rapidly than it should, and it's causing a lot of scale to develop, and it's associated with redness and a rash that you see. But it's mainly just the skin is really growing far too rapidly. Psoriasis can affect people at any age, but it tends to be more common in adults. Most people we see that develop psoriasis are probably in their 20s, teens, sometimes a little bit older. And it just kind of comes out of the middle of nowhere. Sometimes people can be under stress and can develop. Sometimes people can get an infection, like a sore throat, and they'll get what's called guttate psoriasis. They'll get a widespread eruption of lesions that develop, and usually that kind of goes away after a relatively short period of time. Most cases of psoriasis do tend to run in families. There tends to be a genetic relationship to it. So someone in your family tree probably had psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases. And for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter, or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on, and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting, and that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Accuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
Don't forget, for more information on any of the amazing doctors you've seen on today's show, just visit our website, bestdocsnetwork.com. And now let's check in with our next best doctor. It's cosmetic dentist, Dr. Guy Lewis.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change, because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Before I came to see Dr. Masaccio, I was having a lot of pain in my right leg to the point that I couldn't sometimes move, bend, or even walk.
Judy came to see me with a long history of a low back and a leg pain, and it was getting worse and creating more and more.
Did make me feel comfortable, made me feel relaxed. I knew that I was going to do the right thing by doing the surgery.
The purpose of the surgery was to not only decompress the nerve by removing the cyst, but also to stabilize the spine so that the cyst didn't recur, and to help alleviate her back and her leg pain. We did use a minimally invasive approach with Judy, and that involved doing a fusion and placing bone grafting and screws in the spine but doing it in such a way that with a computer-guided system that creates somewhat of an intraoperative three-dimensional image of the spine that allows us to use a percutaneous approach, which is to say minimal muscle disruption, and really help the computer navigate the screws into the spine with very small incisions and very little disruption to the normal tissue.
The way I feel now compared to how I was feeling before is like night and day. Before, I was just in constant pain. Now, which I can move, I can bend, I don't run, but I could. Exercise, it's just totally different. It's totally different. There's absolutely, and when I say this, I mean absolutely no pain at all. I'm glad that I saw Dr. Masaccio.
For more information on any of the phenomenal doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com.
That is the place to go. And Candace, right now the place to go is our next best doctor. It is someone who does a unique procedure. It's Mohs Surgeon, Dr. Patrick Walsh.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so that they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I can have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
There are 4 kinds of hepatitis. Hepatitis is a disease of the liver. This is where your liver gets inflamed and swollen. And the liver is very important in metabolizing certain drugs, and it needs to work right. Hepatitis makes it not work right for a long period of time. There's hepatitis A. This is the hepatitis germ you get from bad food, for example, shellfish, bad sewage situations, for example, in third world countries. There is a shot to prevent that. And that's a great shot to get, especially if you eat out a lot at restaurants where you don't know whether the cooks are washing their hands or not, or if you travel a lot, especially to third world countries. Hepatitis B, this is the hepatitis you get from bodily fluids, for example, transfusions of blood or having sex, that kind of thing, where you transmit bodily fluids. There is a vaccine for that too. It's a 3-dose vaccine. Most kids get this as they go through their young years, but you can get this as an adult if you didn't have it as a child. And then there's hepatitis C. That's what you get from all the other things. For example, certain foods maybe, certain bodily fluids maybe, and many causes of hepatitis C are unknown. There's no vaccine for that. And then there are the other hepatitises that can come from drugs and alcohol. And those are certainly things that you can control.
One of the misconceptions about plastic surgery is that everybody comes in as a model, wannabe, and so forth, but that's not the case at all. There are all different needs of people who come in through the door.
Last year I had a mammogram and I have had 2 cysts in my right breast for a couple of years and was concerned. My mother had passed away from breast cancer. My family physician, she suggested that I come see Dr. Wilcox. I talked to Dr. Wilcox about a breast reduction, and at the same time when I came for my consultation I talked to him about a tummy tuck.
She had had significant weight loss, but she recognized she was still heavy. She was very large-breasted as a result of that and wanted breast reduction, as well as recontouring her abdomen. She was considering having a tummy tuck, but her dimensions after we examined her weren't conducive to a safe outcome doing a tummy tuck. So what we were able to offer her instead was simply removal of the lower hanging skin and fat of her abdomen.
It's something that I'd wanted done for several years but didn't really know if it's something that would be feasible for me. But after talking with him, and he gave me all the information about it and told me how good it would look afterwards, and that's when I decided that I would go ahead with the procedure. I've been very pleased with Dr. Wilcox. His information, his bedside manner, he's very informative. He takes all of the time that you feel like you would want, and any questions that I've had, he's taken the time to draw me pictures and to answer my questions. And his nursing staff and the recovery room, I've never seen anything like it. The nursing staff were so caring, and I never had a fear of anything, of taking infection or anything, because they were so caring and so attentive to my needs.
Listening to the patient, understanding what they think they're going to get, and reassuring them what we can and can't deliver, then we can achieve those goals. Everybody's happy.
We started trying to get pregnant probably in May 2008.
Right.
And so it took us, we tried for about a year before we went and saw Dr. Koo, and then my OB recommended that we go see him.
Amy Baker and her husband unfortunately struggled with infertility for some time. Fortunately, they came and saw me at the office. We did a workup and found out that it was possible that she could still conceive.
Well, there were various tests that I had to go through in order to determine what was the issue. Both of us had to go through certain tests in order to determine what the issue was, and it turned out I had what's called PCOS, and so I wasn't ovulating regularly.
Amy and her husband initially began with some basic treatments for infertility, including insemination. We tried a few rounds of insemination without success, and so we moved quickly to in vitro fertilization. In vitro fertilization occurs where the patient takes medication to grow eggs on her ovaries, and then I go in and I harvest the eggs. We mix the eggs with the husband's sperm, and the embryos are formed. They're incubated for 3 to 5 days, and after 5 days we grade them, and the best embryos are placed into the uterus.
Throughout the process you get a little bit impatient and obviously just want it to happen as quickly as possible, but Dr. Koo makes sure that everything is perfect before moving forward so that you can have a successful procedure.
With Amy, we did transfer 2 embryos. They both looked healthy, but we weren't sure which one was going to make it. Unfortunately, they both made it. So we're very happy for them.
He was so kind and sensitive because obviously he knows it's a very upsetting time for a family who wants to have kids and is having trouble. And so he's very calming and very helpful in just explaining things to you and being very honest at the same time.
The chance for twins with in vitro can range between 33% up to 45%. We're always shooting for success with each try, with the first try especially. So we're very excited that Amy had success with her first try.
The girls are wonderful. They're obviously a lot of fun. Obviously, we're very thankful for everything he's done for us.
For more information on all the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Now to our next best doctor. He's known as the go-to dentist in the Dallas-Fort Worth area. It's Dr. David McFadden.
Prosthodontics is the name of the specialty, and it's one of 9 dental specialties recognized by the American Dental Association. It's a specialty that requires 3 years of additional training at a dental school level. It's 3 years dedicated to the specialty of prosthodontics, which is reconstructive dentistry, including dental implants, crowns and bridges, dentures and partials, some TMJ treatment, and other small areas of dental reconstruction that most people will never need. A typical patient that finds our practice has needs ranging from fillings all the way up to full mouth reconstruction. We handle everything in-house. By having everything in-house, we have total control of patient outcomes, and that's our main goal here, is to have fantastic outcomes. One of the biggest strengths of my practice is the amount of time we spend with each patient. It's all about education here. Every new patient is scheduled for 1 hour, and we go through their complete diagnosis, their treatment plan, and we attempt to educate them on all the options that are available. And it's one of the things that I enjoy the most about my practice, is getting to know the patient and helping them understand their problems, but also giving them several different options on how to fix their problems. We often have multiple try-ins so that we don't just make the patient look good, but we make them look fantastic, because we've taken the time to pick the right tooth size, tooth shape, and tooth color that fits their complexion and their facial shape. Another way that my practice significantly departs from common implant treatment is that I do everything myself. I do the planning, I do the surgery, I do the teeth. It's all me and my hands fabricating these restorations for the patient. There's not a laboratory technician that comes in during the procedure, and no one else touches the patient's care except me. We're committed to patients having long-term success, so we do provide all phases of services, including cleanings and maintenance. Often I frustrate my patients because I'm so picky about their outcome that we sometimes have to make changes, or we have to redo the restoration if I'm not satisfied with it. But it's important to me that we get it just right for every patient, whether it takes extra time or not.
The problem of misdiagnosis in terms of where people believe they have pain and where it really originates is extremely common, and almost seems like it's getting to be more so as patients take medical care into their own hands a bit more these days.
The pain would present itself where it would be a dull ache at times, and then it would transform into the shooting pain. It would radiate out from my hip and go across my abdomen and straight down my leg. And whenever I would walk, I would feel like a stabbing pain in my hip and in my upper leg.
The spine is usually the culprit, either the neck or low back. All the signals that we get from different body parts, signals of pain from arthritis or from an injury, have to be transmitted through the spinal cord to get to the brain. And any short circuit along that pathway can be misleading.
When I first saw Dr. Sadie, he took a very conservative approach towards my pain, and he sent me to see an anesthesiologist, and we tried to do some nerve blocking procedures, and that was one of the things I really enjoyed about Dr. Sadie. He wasn't rushing to put me under a knife right away. Eventually, the pain was not going away, and the anesthesiologist said that there was nothing more that they could do for me, and so Dr. Sadie then recommended the T-lift procedure for me.
Once the determination was made as to where his pain was coming from, we came up with the procedure, which is called a decompression and minimally invasive fusion, which is creating more space around the spinal cord for the nerves to exit freely and then stabilize the motion segments.
This procedure was a life-changing procedure, nothing short of that. Before the procedure, I'd wake up with pain and stiffness. 30 days post-procedure, I feel like I can do the activities that I've done when I was back in my 20s and 30s. Both the visit to Dr. Sadie as well as my experience at Forest Park were extremely positive. And I'm happy to say that the outcome was positive because I can sit here today and tell you that I'm 100% pain-free. And that is the ultimate measure of my success.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Dana, a mother of 2, was diagnosed with breast cancer and credits Dr. Patrick Allen for saving her life. To find out more about Dana's story and other life-changing stories, log on to bestdocsnetwork.com.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, you know, pulled up the neck and, you know, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, you know, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. You know, nobody's pressuring you. So I just felt comfortable with him.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in all of the Dallas and Fort Worth area that are helping to change people's lives.
And for more information on any of the outstanding doctors you see on today's show, head to the website bestdocsnetwork.com.
And if you have a question or a comment for us, we'd sure like to hear from you. Send us an email at info@bestdocsnetwork.com.
And the good news is, hey, the latest Best Docs Network magazine is out in your community.
Check it out.
So long, everyone. We will see you next week.